$51,000.
$140,000.
Two families, between them nearly $200,000 in medical debt. April Harias' son Connor had a severe allergic reaction in Fairfield. The doctor ordered a helicopter to fly him to Children's Hospital in Oakland right away.
I was terrified. I didn't know what was going to happen.
David Rodriguez's twin sons Nolan and Evan came down with a life-threatening blood condition in Arcata. So the doctor ordered a medical airplane to rush the twins to Stanford Children's.
Don't mess around. Get these guys into a NICU right away.
Both families have health coverage, but their insurance companies refuse to pay. Both said the air ambulances were not medically necessary.
Why do they think they're the ones equipped to make that judgment call?
After we got involved, each insurance company paid up. $51,000 to April and $141,000 to David. But we wondered why those prices were so high.
I happen to think that that's beyond price gouging.
Lisa Blackstock is a patient advocate who helps people fight medical bills. She says air ambulances weren't always this expensive. We found a 2017 federal study that shows median medical flight prices nearly tripled from $15,000 in 2010 to $40,000 in 2016.
It is a costly, very cost-intensive industry.
Don Wharton helps run a big air ambulance company. He blames Medicare and Medi-Cal for the big increase. They pay about $6,500 max per flight. Air ambulances say that amount doesn't cover their costs. So to make up the difference, they charge everyone else more.
It comes down to reimbursement, actual reimbursement per patient. And what we have found, again, there have been no adjustments on Medicare.
Is it fair to then charge everyone else so much more?
I think it's very fair that we keep these services available to the 80 million rural Americans that we provide this service for.
But something else has been happening too. The Government Accountability Office notes several recent mergers, acquisitions, and private equity firms buying up air ambulance services, limiting competition. Today, just 3 private operators control 73% of the country's air ambulances, and prices keep climbing.
Ready, set.
Families like April's and David's, and probably yours, face yet another issue: insurance. Just about all air ambulances are out of network.
The very large insurance companies seem to be unwilling to really, quote, negotiate where we have favorable terms, where we can really be in network.
But the insurance industry told us the opposite, that air ambulance operators won't negotiate. United Healthcare said many, especially large national air ambulance providers, have refused to participate in our network. So if a medical emergency forces your family to use an air ambulance, get ready for a crushing bill.
There's got to be a better way that they can make better use of their equipment without having to overcharge literally everyone that they fly.